Buenos días a todos. Mil gracias por participar en este
Good
webinario.
morning to all of you. Thank you for participating in this webinar. My name is Margarita Giseli, Regional Immunization Advisor at PAHO at WAHO headquarters, and welcome to all of you to this webinar. First, I want to take advantage of the space to wish you all a happy Vaccination Week of the Americas week with so many people vaccinated in this year. This April, the member states of the region have agreed to maintain the vaccines on their political agenda again. In this context, conversations around vaccines become of primary importance. The active conversations generated nationally and internationally on COVID-19 vaccine show that we have to have timely, reliable, and easily accessible information about the vaccines and their safety, which closes information gaps and responds to questions that act as barriers to vaccination. In the region of the Americas, PAHO has contributed to the establishment of the SAVI surveillance system, which is the supposedly attributed to vaccinations and immunization to consider undesirable events and respond to them. However, the task of translating the scientific data into recommendations and guidelines for the public requires broader and more sustainable action. One of the strategies launched by the World Health Organization is the Network Vaccine Safety, the VSN as it's known in English. The VSN is a global network of web pages that helps users find reliable information on vaccine safety. WHO and all its members allows for the use of the VSN pages that comply with past criteria and good communication practices presented by the Global Advisory Committee on Vaccine Safety. The goal is to help the public identify reliable, evidence-based vaccine safety information. Currently, VSN has 104 members, of which only 14 have information in Spanish and 3 in Portuguese. Neither site comes from an organization in the English-speaking Caribbean. Expanding the network of VSN members in the Americas will help the public in our region to identify reliable, evidence-based vaccine safety information, helping to maintain confidence in vaccines. In this webinar, colleagues from the 4 beneficiary organizations will present the achievements and lessons learned through their participation in the VSN network expansion project proposed by PAHO, which lasted 16 months and included the development and use of multiple tools to guide the work. Through this webinar, we seek to encourage other organizations in the Americas to improve their online content on vaccine safety for applying VSN's criteria and best practices, as well as the guide documents that have been created over the past month. We hope that the information presented today will be helpful in continuing our mission to inform and educate the public about the benefits of vaccination. Thank you very much for your attention and happy Vaccination Week in the Americas. And now I'm going to give the floor to our colleague, Claudia Arhin, International PAHO consultant, for an introductory presentation of the VSN project in the Americas. Thank you very much, Claudia. You have the floor. Thank you, Margarita. And it's a pleasure to be here with you today to talk to you about the Vaccine Safety Network expansion in the region of the Americas, which, as Margarita said, is something we've been working with in the last 16 months, beginning October of last year to now, directly working with the beneficiary organizations to strengthen their websites and thus comply with the VSN criteria of the region. In this presentation, I'm going to talk about the importance of improving the quality and visibility of the information on vaccine safety in the Americas. I'll give you a general overview of the project, of the expansion of the safety network, and we'll talk about the main results of the project we implemented in starting January 2023. First, it's important to explain why we have to talk about safe vaccines. There are many factors that affect the decision of vaccinating or not, and a key factor in this context is the risk perception, not so much of the disease itself, but of the vaccine. A person can believe that the disease may be not very severe or not possible, and the effects of the vaccine can be severe or probable. So the best ways to consider two factors: the probability, for example, is it probable that there could be a safe side effect, and severity, if it does occur, how severe is it? Usually, if a person perceives that the risk of the disease is high, it's probably it's most probable that you'll vaccinate or vaccinate the child. But if the person perceives that the risk of the vaccine is higher, they'll be less tending to use the vaccine. The ESAVI, which are the events supposedly attributed to vaccination or immunization, be real or perceived, is one of the main causes of hesitancy and rejection to vaccines. Therefore, in the context of the vaccine safety, transparency and communication is fundamental to generate and maintain the public's trust. It's crucial to present key and incomprehensible aspects of the effectiveness and safety of the vaccines, as well as the approval and monitoring processes. In supplying access to information that's verified and updated, the health authorities may show their commitment with safety and strengthen the trust in the vaccination system through communication, effective communication on vaccine safety. We seek to create, maintain, or restore trust in the vaccines, in vaccination, and in the authorities that administer it. When speaking of assertive communication on vaccine safety, it's important to first consider what we can communicate. And this is a response we can find in the safe vaccination model proposed by PAHO, based on the interinstitutional work done by the different actors nationally and regionally to ensure safe vaccines. This model shows the aspects related not only to adverse events and the information related to these, but to strategies used to ensure that vaccination is safe. The model speaks of what the storage processes, distribution processes, cold chain systems mean, and the risks, and how the authorities work in a comprehensive manner to harmonize these. It also proposes all aspects related to adverse events and the processes and components that ensure that after an ESAVI, there's a response, including the debates on what the surveillance systems are, and it allows the public to understand that there are international and national systems that survey vaccine safety and contribute to generate information on this topic. This model offers us the possibility of being a model for websites to give ideas of what topics to approach when communicating vaccine safety issues, what to go into greater detail, and how to do it. The safe vaccine model is the first tool to understand what it means to communicate about safe vaccines. And for more information, you can check the regional ESAVI surveillance manual, which is in the PAHO's website. The VSN, or Vaccine Safety Net, is a repository of vaccine websites supported by PAHO, which complies with the good communication practices approved by the committee, with reliable information on vaccine safety in different languages, and allows the public to access validated information which is evidence-based. Up until October 2023, 31 websites were members of the VSN in the region of the Americas, of which 23 were in English, 7 in Spanish, and 1 in Portuguese. In total, these sites have a traffic of 176 million monthly visits, highlighting the need to have sites with reliable information and evidence-based in the region.
Las tendencias de Savi
Leyendo la mujer y no nos mandó el texto.
de las Américas para la toma de decisiones por autoridades de salud pública. Sin embargo, nos enfrentamos a una brecha importante, y es que esta información raramente se disemina al público, lo que dificulta el propio proceso de toma de
Which
decisiones.
makes the decision-making process difficult. We observe that most of the web pages offering information on vaccine safety are mainly based on regulatory aspects of the introduction and administration of the vaccine and deal with the vaccines mainly against COVID-19 during the context of the pandemic, a limitation which exclude other fundamental aspects of vaccine safety, which the public need to know. Lastly, we find that there's very little information published on vaccine safety available in Spanish or Portuguese, as well as published by organizations in English Caribbean. This lack of access to information in the local language and coming from regional sources affect the people and communities' abilities to make informed decisions on vaccination. These gaps we've identified highlight the need to deal with the gaps and communication on vaccine safety in the Americas, ensuring that the information is accessible, understood, and relevant for all communities. That's why through the expansion network of the VSN project in the Americas, we seek to improve the access and accurate information on vaccine safety to include specific regional websites, including scope and availability of accurate and updated information for the public. Our objective includes offering comprehensive support to four organizations selected to strengthen their web pages on vaccine safety, ensure quality of content, credibility, design, and accessibility to the information, and communicate crucial aspects effectively related to safety, the risks and benefits of the vaccines, as well as the promotion of the safe vaccine model to generate trust and maintain optimum vaccination coverages in the region. The project included technical support in the selected organizations, which were the Public Ministry of Colombia, the ALMA project and the Foundation for Development in Guatemala, the Honorary Commission for the Fight Against Tuberculosis and Prevalent Diseases in Uruguay, and Ministry of Public Works, Public Health in Trinidad. Considering evaluation and diagnosis through an exhaustive analysis of web pages, to identify areas of improvement in quality of content, credibility, and design and accessibility. Development of technical content through assistance with public health experts and communication so that the content would be relevant, accurate, and easy to understand. The design and accessibility, working together with the developers and web designers and specialists to improve the design of the web pages. And lastly, implementation and follow-up through implementation of changes in the web pages to compile the feedback and make the necessary adjustments. And lastly, we have the success measurements. Our success measurement strategy was based on the evaluation of the four key aspects of the criteria proposed by the VSN, of which I'll speak of in a few minutes. The VSN criteria are grouped into four areas: credibility, content, design, and accessibility. Using the criteria established by the VSN, we did initial evaluations with each website, designing a tool to evaluate the compliance with these criteria, and the results are used as a starting point for the organizations to design a work plan to strengthen their websites. The initial evaluations were done in October of 2023 and ended now in April of 2024, so as to have pre and post measurement of the implementation project. The charts will show the results of these evaluations in both time sides. The blue line is a standard or compliant with all the VSN criteria, and the orange line shows the results of compliance for the organization at the time of the evaluation in April. No, she corrects. At the time of the evaluation, on the left of the screen, we have the October evaluation, on the right, the final evaluation, which was done in April. Each organization started from a different point in terms of what they should improve. And the results you see on the right side are results of the constant and dedicated work of the staff of the organizations who diligently coordinated the teams to design content generation strategies, drafting and promoting editorial policies in their organizations, working in general with the technical content, evidence-based content, and finally worked with the designers and web developers and designers to make the necessary changes and publish the information. In this slide, we see the results of the evaluation for the expanded immunization project of the Ministry of Health project in Colombia, where they've made an enormous effort to completely remodel their webpage, which they began in 2023 and still continues. Specifically, the expanded immunization project has made an effort to strengthen the technical design and web pages to include information not only of the vaccination schedules and some pointed aspects related to vaccinations, but the EPI project redesigned everything and now includes technical information, which includes the 5 components of the safe vaccination model and the VSN criteria. The second organization is the Honorary Commission for the Fight Against Tuberculosis and Prevalent Diseases in Uruguay. And as you see, the initial evaluation encouraged the colleagues in Uruguay to focus their efforts mainly on the credibility criteria and content to strengthen their website and comply with the specific VSN criteria. Through the teamwork and active coordination, today their website strengthened and redesigned includes a specific session focused on immunization, and the public can find information on the benefits and risks of vaccination, the SAVI surveillance, the quality vaccination component, and the processes for storage, distribution, and cold chain processes which contribute to the safety of the vaccines administered in the country. The third organization that benefited from the project is the development project ALMA in Guatemala. The ALMA project includes a communication platform which seeks to offer information on health aspects to the Guatemalan population. Though the ALMA project already had a specific site for vaccine information, the preliminary information allowed ALMA to focus through this project on implementing good practices to improve their credibility, increase the technical content, and improve accessibility of the available information in their website. The results of the evaluation show significant improvements in each one of the criteria evaluated by the VSN, contributing to the objective of the organization and the project to improve access, evidence-based access to information. And finally, the Health Ministry of Trinidad and Tobago, through the project, saw the need to focus their efforts on improving credibility, content, and accessibility of their website. Today, their renewed website in Trinidad and Tobago includes not only specific information on some of the vaccines, but refers to the vaccine safety issue from a more comprehensive aspect, offering the public information on the development processes, as well as the constant monitoring of this, which contributes to vaccine safety. Furthermore, they included information specifically on what the SAVIs are and how the ministry works to supervise the safety by monitoring through SAVI and what are the SAVIs documented for some of the vaccines administered in the country. The Ministry of Health in Trinidad and Tobago has also managed the participation of the epidemiology team, the immunization program, and the information and technology college so as to develop and add a content generation strategy allowing the Ministry of Health to maintain initial efforts. As we saw with the results shown above, through the VSN project, we were able to increase the number of reliable information sources on vaccine safety in the region of the Americas. The 4 beneficiary organizations include in their websites up-to-date information on the vaccine safety, which goes beyond the information included in the response to the COVID-19 vaccines. It includes also the 5 components of the safe vaccination model and the VSN network criteria of the World Health Organization. The information in the websites is complete, accurate, and evidence-based. And the organizations implemented attractive designs, making it easy to navigate the website and improve the user's experience. And finally, by implementing the optimization strategies in the online searches, the information is more accessible and more visible for those seeking information on vaccine safety in the region of the Americas. With these efforts, we make it easy to access reliable information on vaccine safety coming from organizations and public health agencies in the region of the Americas for all internet users in the region. And I don't want to neglect the opportunity to mention that the tools we developed through this project are available for all organizations wishing to start this process of strengthening their websites to comply with the BSN
En
network
seguimiento al webinario, recibirán un
criteria.
correo
And
con la
after the
información de
webinar,
usuario
you'll
donde se
receive
encuentra una caja de herramientas
a
incluida
link where
la
you'll
herramienta de
include the
evaluación de
tools, which
criterios
includes
beneficiarios
the
en el contenido
BSN
técnico,
criteria evaluation
una
and the
guía que
technical
reducirá
content,
acciones
a
para desarrollar una
guideline
estrategia de
to
generación de
develop
contenido
a
sobre
content
seguridad de vacunas,
generation
y un
strategy on vaccine
documento con
safety, and a
recomendaciones para
document with
desarrollar una
recommendations for the
política
development
editorial
of an
para un sitio web
editorial
sobre
policy
seguridad de
for a
vacunas.
vaccine safety
Muchas gracias.
website. Thank you
Especialmente a las
very
cuatro
much,
organizaciones que nos
especially to the
sentimos
4
felices
organizations
por
we've been
trabajar
working with
en este proyecto.
in this
Es a
project,
través de sus esfuerzos y
and
del
it's
interés de
thanks
buscar
to
la
their effort
excelencia
and their
y
interest
contribuir a
in
reducir la
excellence to contribute
desinformación
to
o
reduce
eliminar las fuentes culpables de la
misinformation and
información
reduce the lack of
que han hecho
information
de este esfuerzo
that
un éxito.
has
Gracias
made
también a los
this
miembros
effort
de
a
la
success.
OMS
Thank
y
you
del
to the
CDC por el
WHO
apoyo
and
continuo a
CDC
lo
for
largo
their
de este
continued
esfuerzo.
support throughout this
Te
project.
regreso a ti, Margarita.
Margarita, back to you.
Mil gracias, Claudia.
Thank you, Claudia.
Por todos los participantes, si hay
And
preguntas, por favor,
if there are
aprovechar
any questions,
del chat
please
Q&A
make use of the
y
Q&A
contestaremos a las
on
preguntas
the chat,
después de
and
las
we'll answer the
presentaciones de las
questions
cuatro
after all the
organizaciones.
presentations from the 4
Entonces, otra vez,
organizations.
mil gracias, Claudia.
Once again,
Y
Claudia, thank
pasamos
you very
la
much.
palabra a
And we'd
nuestros
like to give the
compañeros
floor
del
to
Ministerio de
our
Salud de
colleagues
Colombia
from the Health
por
Ministry
su
of Colombia.
presentación sobre
Thanks
los
for your
logros y acciones
presentation on the
aprendidas
achievements and
alrededor de
lessons
este
learned
proyecto.
around
Entonces,
this
Sandra, por
project.
favor, gracias.
Sandra, you have the floor. Thank you.
Hola, muy buenos días.
Good morning. Thank you very much.
Ya estamos acá. Ok, listo. Permítanme, tomamos opciones de puntero. Listo, perfecto. Bueno, muy buenos días a todos y a todas. Me
Thank you.
presento.
Good morning to all of you. My name is Sandra Rodriguez. I'm nursing public health reference of the expanded program on immunizations in the Ministry of Health in Colombia. And today, what we want to do is tell you a bit of our experience in this certification process of our BSN website, which was a tremendous challenge for us. And we're going to refer specifically of how the tools developed by PAHO helped us enormously in our planning and publication of the website. And as Claudia mentioned, are being able to strengthen the information and the communication on vaccine safety. We felt basically that this was a wonderful opportunity as a challenge in October of last month, where we participated in that project of the vaccine safety in the Americas. We had a baseline, basically, but the Ministry of Health and Social Protection is a public entity in the national government, and we're in charge of informing, addressing, evaluating, and guiding all health policies. And we are a place where you have all the information about the EPI. In October of 2023, we saw this opportunity to participate in this project, and the baseline we had was a website which had content for the program but needed an update of the content. We had identified the need to institutionalize the process, especially in the content management aspects. I'll show you a little later about this. And we had the creation of a new Min Salud website, which is in construction, and it depends on all the areas of the health ministry. The project is to follow specific times to advance with this new website. What we also had were the need about the infodemia we have regarding vaccines and vaccination, and EPI, which is dynamic, the evidence-based, the schedules, the implementation of new vaccines, and a situation of important synergy with the communication and the technical team of the EPI. This communication component of the EPI is something which we have sort of left behind in the technical part of the program, but we realized that this was vital, that that digital information and that positioning and the trust in the vaccines and the access of the people to the system and the social networks and the digital information, it was important, and we felt that it was something we needed to strengthen to position us adequately as a program. This is what we had in our website. And as I said, it was general of the Ministry of Health. It was in a process of transition at the time. We began to evolve the project. We had a presentation in October of 2023 and decided that this was a wonderful opportunity for us to uh, promote this idea of updating our website. We identified the gaps and the available resources, the needs or the criteria defined by the BSN and the EPI project, and also the needs we had in the expanded program on immunizations. This was a wonderful moment where we made the decision to work with a subdomain of MinSalud, which was part of the MinSalud page, but it allowed for different schedules and developments independently of the huge site we had from the ministry. And here we build the whole content, the digital structure, mirroring what the new site would look like so that when it's the huge Min Salud domain comes out, it would just be a question of migrating the content. And in the meantime, we were having a subdomain, which is completely operational and one can consult it. And then we have another important element, which was the institutionalization of the processes. In the EPI, we are quite rigorous regarding the processes of other components in the cold chains, the safe injection, planning, coordination. But as I said, this process is a communication component which we had sort of left behind somehow. And under these circumstances, we felt it was important to make it as rigorous as we had with the other components, which was one of the lessons we learned in this process of the BSN criteria application and in the expansion of the network. Our roadmap, and here we begin to speak of all the things that we received from the tools that Bajo gave us to help us create and plan our website. Those BSN criteria that Claudia referred to in her presentation served as the roadmap and continue to serve as the roadmap, showing us the importance of credibility, content, quality, accessibility, and design, setting the basis for the way in which I present the content, which and what is important to present when speaking of quality content. Understanding the complexity of the program, one thinks that everything is important, but there are certain things that one can begin to talk about initially, to which we should give maybe for the greater priority. So those content and quality were very important to guide us. I'm sorry, we're losing the speaker. There was transparency, dissemination of the information, the mission, the vision, the technical aspects we didn't know much about. So this was really interesting for us to learn to include those important elements in the publication of the information. We began to work in our content management, which were probably the first steps that we had to define. We built the work plan, we defined the gaps vis-a-vis what we needed as a program and what the certification for the VCN requested. We began to work in sequence in generating content. And I'll show you in a minute what our work was. These were the different milestones of the program, which we felt were the most landmark issues in the process. The first, and this is almost like an ad to encourage other countries to join, we had continuous support from the BSN, WHO, and PAHO teams. The technical support, the technical help, the digital assistance. Often as nurses, we're the ones in charge of the technical part of the program, but we don't know much about this. But that technical support was always there helping us, and that helped us with all the resources that were so important to advance in the project. We also had some resources available using as a reference other contents from other VSN pages that were members of the VSN, which were in the certification. And that also helped us use the references of the way in which we can show the information without it being so dense.
And that would also be attractive as we looked at winning over the reliability and confidence of our users. Now, looking at the selection process, we had an opportunity to manage the allocated resources. We were able to hire a team that provided technical support in designing the web, and they looked at focusing on generating content that looked at the specific approaches relating to VSN and also expanding our potential for communication and in the area of healthcare, looking at how we can implement these policies. Another key milestone, and I think this was a very significant one, and you can see that in the tools provided by PAHO, we see the building or construction of editorial policies with regard to MinSalud Colombia, the fact that we need to rigorously look at how we are planning policies in addition to looking at specific guidelines is how we're going to generate guidelines. And then we develop documents that include methodologies, guidelines, and defining, creating, and updating content. So these were some of the key components in our roadmap. We need to define specifically how we were going to publish the content and following specific rigorous standards and guidelines, ensuring transparency in the information that we publish, ensuring its accuracy and reliability. And we looked at the institutionalization of the management processes governing the contents with the recommended rigorous requirements, ensuring the viability of the project, documents that have become institutionalized. They don't just belong to an individual or an administrator, it's institution-wide. This is our web page, and we're hoping to launch this as of beginning of May, looking at specific criteria, the content that was recommended, and we also have the vaccine schedules where we can, with these sites where these vaccines can be administered, and we're looking at the vision, the mission that we provide in that spirit of transparency. And we have a component that deals with the technical resources, the tools in terms of the guidelines, the various newsletters, updates, also some background history, so that we can get more information made available to those involved in administering the vaccines, and then looking at some of the lessons learned along the way in the process, documenting and institutionalizing processes, procedures that are essential to provide successful results, interdisciplinary efforts that are not very simple, but they are extremely enriching, addressing the digital scenarios that are significant in the healthcare sector, providing a work path to ensure that the contents can be clearly delineated in the vaccination process. And here we have the focus on, in the short term, we continue to generate the technical content, build and implement the guidelines for evaluation and performance of the website, also working within the ministry. By mid-May, we are also going to submit our candidacy for VSN, and in Colombia, we want to become a reference in terms of information relating to vaccine safety. We also want to continue to contribute to the contents of the framework of needs. Thank you very much. Thank you, Sandra, for that excellent presentation that clearly depicts how the protocols and tools that we've developed jointly throughout the process help to contribute to support the publication of this new institutional website on vaccine safety nets. And now let's move on to our colleagues from the Alma Fundegua from Guatemala. Go ahead, Alejandra. Thank you very much, Margarita. And I want to thank everyone who's joined us. I am Alejandra Perez, and I lead the ALMA project, looking at the automated logistical support for the Guatemalan Ministry of Health. We are helping everyone lead more healthy lives. That's our mission. So within the COVID context, we identified a very serious challenge in the country where we needed to enhance our communications resources. People would find out information too late. There was a lag in the dissemination of content. So our solution was that Alma could become the first stop for those who needed help in navigating the healthcare services and information resources. So the Alma system is accessible to all and has an impact on the healthcare systems with automated triage. We also provide evidence-based information, cooperation in real time, among our other services. We have various digital platforms. This is the Tu Salud platform. This is the most updated one. This is a technology product within the Alma system that allows us to find information, learn about more that we're seeking to learn about, and share it. Tu Salud with Alma in 2023 contained an infrastructure with information and technology data. We had clinical equipment and development of technology training opportunities. We provided a web design team for an experts in communication, processes in development, review, and publication of articles published. We have, in terms of our clinical aspects, information about the vaccine schedules, logistical information on vaccines in Guatemala, information about types of vaccines available, and information related to vaccine safety focused in the COVID-19 context. Technology aspects included a website that was launched to the public, a intuitive and coherent and consistent design. Nevertheless, despite these opportunities, we ask ourselves, what is next? How can we make improvements to what's already been developed? So these are some of the upgrades that we were looking at in terms of the Tu Salud website. Among some of the activities within our process to update the website, we use automated tools for measurement. We seek technology alternatives that are user-friendly and can be rapidly implemented. We improve or we manage load demand learning opportunities. We provide vaccine safety concepts. We consult various sources of information to adapt the information to the Guatemalan context. We also use information that we already had on our original website, but we upgrade the content in accordance with the standards and requirements. Now, let's take a look at Tu Salud after the update that was focused on vaccine safety nets. We've seen improvements. Now we have publication policies that we posted on the website. Information about financial policies is also published on the website, and information provided to the public regarding the Alma equipment and teams and points of contact clinically. We have more information regarding vaccine safety, information about the development of vaccines, that process, information regarding the vaccine's benefits, and information about uncertainties and risks that are associated with a vaccine. So among the technology aspects, we've tried to make the information. We didn't want to make the information too technical. We wanted to make it user friendly. For those who access the website can understand the content fairly clearly. We want we optimize the SEO. We have protocols in place in terms of accessibility, and we made efforts to make the search process more efficient. So we have, of course, besides the learning processes, we have challenges, successes, or achievements. Among the learning process, we need to adapt the language and scientific terminology to get the public to better understand the content. Also, we stress the importance of clearly delineating and explaining the various uncertainties and doubts related with vaccines, and also make sure that we've developed efficient strategies in order to clearly present the information in the articles. We continue to work with the PAHO team, where we share the workload. Because we're an NGO, we have a small staff. So the overwhelming work that we had to conduct was, although it was daunting, we were able to do it. Despite this workload, we were successful in coordinating efforts among the teams to obtain final results in terms of the technical communication. Also, another challenge was that we had very limited information regarding the national regulatory authorities. So we wanted to make sure that the information would be easily accessed to the public. Among our achievements, we've already published 10 new articles. We've identified and completed 32 mandatory as well as additional requirements and criteria. We also now have provided information related to the vaccines that are targeted to various segments of our society, including pregnant women, those who are immunocompromised. Now, looking at the reflections on the technology and equipment, in our learning process, we've discovered new tools for measuring progress. Also, we've identified more efficient strategies in deploying and addressing the changes, conducting tests. We also realize the importance of having a website that is easily accessed, intuitive, and user-friendly. Also, we learned about the need to cultivate and build on the trust and confidence of our users through transparency policies, which is considered a fundamental pillar of support. Looking at the challenges, we're changing our initial technology, and that was a challenge. We were able to, in order to introduce new technologies that would help scale up more quickly, also clearly defining the correct processes and policies regarding the use, increase the performance level of our web page, and we've been able to optimize our search and query options in all of our web pages. We had a greater average of SEOs up to bringing up to 90 points, 64 criteria, and we've increased our experience working with PAHO in these areas. Now, some of the technical conclusions include, and this is related to information on the website, the we provide information that is comprehensive, objective, and its contextualized results have contributed to empowering families, giving them an opportunity for better informed health decisions. Also, working in cooperation with non-governmental organizations has shown the viability of external partnerships, as well as the impact on the community. The use of technology has enabled finding new solutions. Now, with regards to overall conclusions from this experience, with the project, we've been given the opportunity to have a structure that is vital in order to better structure our activities, to improve and translate this to more time, and also to have a goal that where our goal is to be a part of the vaccine safety network to help to delineate the scope between the standardized criteria of clinical information and accessibility that can be sometimes more difficult to define. The follow-up and support in terms of clinical information, of context and technology aspects has been vital in order to address these bottlenecks and obstacles. This, again, has allowed us to, as you could see with some of the results from the evaluations that we've undertaken that support better health. So thank you very much for giving me the floor. Thank you, Alejandra. Excellent presentation. I think it clearly depicts the successes that you've had in expanding the web page, and that includes content that is essential for improving health.
To discuss how to strengthen the institutional content of their web pages related to vaccine safety. So please, on to you. We might have lost our colleague from Trinidad and Tobago. We'll try to get her back online. Oh, no, here she is. Dr. Shamel, please go ahead.
Hi, good morning, everyone. I am Shamal Paradise, Manager of Corporate Communications at the Ministry of Health. I'm just asking if everyone is seeing my screen, please, to confirm. Thank you so much. Hola. So I'm from the Ministry of Health, Trinidad and Tobago, and today our presentation will be on how we prioritize activities to develop and promote vaccine safety content on the institutional website. So emerging from the COVID-19 pandemic, it became evident that vaccine mistrust and misinformation significantly global vaccine uptake. This trend, famously known as the infodemic, seriously affected the perceptions of vaccine safety broadly. The persistent misinformation required robust educational efforts from health authorities like the Ministry of Health, Trinidad and Tobago, to enhance understanding and compliance with vaccination programs. So to provide an overview, the strengthening of our website through the development and promotion of vaccine safety content is an important part of building trust towards vaccines.
Yeah.
The development...
Apology, Dr. Shamel. We are not seeing the presentation in full view, so we are not seeing the slides move.
My apologies. Let me try hiding this. be projected.
All right, thank you. We're seeing the overview slide. If you could put it in presentation mode, it would be fantastic.
Okay. Can you advise me if you're seeing the screen now?
Not full screen, but just please go ahead and we'll just move with this. We'll let you know once we can move to the next slide.
Sure.
Sorry, just to recommend you, if you can stop sharing your screen and share your desktop, because maybe you are sharing PowerPoint. It's better if you share your desktop, so we will see the presentation more.
Share the desktop. Okay. Better. Presentation. Can you advise if you're seeing the screen now?
Yes, perfect. Thank you so much.
Okay, great. All right, no problem. So I'll start back on from the beginning, if that's okay. So our presentation from the Ministry of Health Trinidad and Tobago is how to prioritize activities to develop and promote vaccine safety content on the institutional website. So emerging from the COVID-19 pandemic, it became evident that vaccine mistrust and misinformation significantly impacted global vaccine uptake. This trend, famously known as the infodemic, has affected perceptions of vaccine safety broadly. This persistent misinformation required robust educational efforts from health authorities like the Ministry of Health Trinidad and Tobago to enhance public understanding and compliance with vaccination programs. The development and promotion of vaccine safety content is an important part of building trust towards vaccines. For this reason, the Ministry of Health Trinidad and Tobago welcomed the opportunity to partner with PAHO to achieve World Health Organization Vaccine Safety Net membership. So indeed, the strengthening of our website will lead to persons making informed choices to protect themselves and loved ones from vaccine preventable diseases, and by extension, hopefully make a country more resilient towards vaccine preventable disease outbreaks. So a strategy for implementation, these included the development and promotion of vaccine safety content, and the three main activities involved the engagement of key stakeholders, the development of a content generation strategy, and use of assessment tools. So we'll now take a look at each activity, which the first one will be the engagement of key stakeholders. And this is basically where we foster continuous collaboration with all relevant parties. The engagement of key stakeholders definitely made this project a success to us. Technical support was provided by way of collaboration with PAHO consultants and the ministry's expanded program on immunization for technical advice and content support. We held weekly team meetings to ensure project alignment and adherence to deadlines. Provision of diagnostic and content analysis tools were also, were also utilized to evaluate any content gaps. Working sessions to develop content generation strategies and insights from other BSN members to redefine our approach. In addition to receiving technical support, feedback from the general public was also a mechanism used to engage the audience perception on matters relating to vaccines and vaccine safety. This feedback was crucial in developing the content for the website. So our second activity was the development of a content generation strategy. And this basically outlines the procedures needed for the development and management of content on vaccine safety. The main goal of this project is to improve Trinidad and Tobago's population access to credible, objective, and evidence-based information on vaccine safety by updating the Ministry of Health's immunization webpage. For this to happen, a content generation strategy was created to outline procedures needed for the development and management of content for the webpage, especially that of vaccine safety. So some of our key components included rules of engagement for content creation, establishment of editorial team and their rules in terms of content delivery, management, performance and evaluation, and development of the editorial policy, which outlined the principles, standards, and procedures followed when publishing content on the Ministry of Health's immunization webpage. The content generation strategy will also ensure continuity in this project to ensure that the information shared is credible and timely. So our third activity focused on the use of assessment tools. And these are basically where we deploy diagnostic and content analysis tools to evaluate and enhance the existing website content. And with the aid of a content analysis tools and diagnostic, which was offered by PAHO, assessments on the Ministry of Health website were performed to provide details on our level of preparedness in the content of vaccine safety content. The diagnostic tests were conducted by PAHO to ensure compliance with VSN criteria and to improve the web page structure and architecture. This is also in an effort to improve navigability, accessibility, to simplify the public user's experience while searching for information on vaccine safety. The following image shows the results of the assessment done, and based on this analysis, it was clear that we needed to address content, quality, and quantity of the content in relation to vaccine safety. The content analysis tool, on the other hand, after performing a detailed mapping exercise, identified gaps in the existing content related to vaccine safety. Overall, these tools help to enhance the webpage usability and structure, as well as to update and expand vaccine safety information. So in conclusion, our strategy in employing active stakeholder engagement, a content generation strategy, and assessment tools have proven to be an effective blueprint in development and promotion of content on vaccine safety for any institution. Communicating objectively about the safety of vaccines, including its risks and benefits, is critical to building trust in the vaccination process. By restructuring the Ministry of Health's vaccine and immunization webpage, Trinidad and Tobago's population will have increased access to reliable information on vaccine safety, and we anticipate improvements in the uptake of vaccines. So what are the next steps? The next steps involve launching the revamped webpage and applying for Vaccine Safety Net membership to solidify our commitment to providing reliable vaccine information. In closing, we wish to acknowledge the support from our colleagues at PAHO and express optimism in the positive impact of this project and vaccine safety perception in Trinidad and Tobago. Thank you.
Thank you very much, Dr. Chamel.
Muchísimas gracias, doctora.
Presentation and really helping us understand your thought process around prioritizing activities to develop and promote vaccine safety content on your webpage, again, within this institutional framework. Really excellent presentation, and thank you so much. Y entonces ahora pasamos a la última presentación de
Now
los
we're going to go to our last presentation for the colleagues from Uruguay, the Honorary Commission for the Anti-Tuberculosis Fight and Prevalent Disease. I'll give the floor to the colleagues from Uruguay to hear from them what their experience has been like. Thank you very much. Good morning to all of you. How are you? Can you confirm that you see my presentation and you hear me well? Yes, there it is. Thank you.
Bueno, muy bien. Entonces, gracias a todos por la invitación. Voy a presentar un poco sobre la experiencia que hemos tenido en Uruguay.
Well, thank you very much. Good morning to all of you. How are you? Can you confirm that you see my presentation and you hear me well? Very well. First, I want to thank those present. Thank you very much for connecting. My name is Amanda Rodriguez, and as I'm in the Communication Design and Promotion Office of the Honorary Commission for the Tuberculosis and Relevant Diseases Fight in Uruguay. Briefly, I'd like to talk to you about some of the aspects, tools, and guidelines that will help us ensure sustainability of the changes implemented in these last few months and maintain the integrity and relevance of the vaccine safety content we give the population on our website. To give you a bit of context, first I'd like to tell you that our institution is a public non-state organization in charge of several national health programs, including the National Vaccination Program amongst them. And it's in that context that our participation was fundamental to later form part of the VSN member. As I mentioned initially, I'd like to tell you briefly of some of the tools that will help us ensure the sustainability, which is so important, so that these changes will be set not just for these last few months, but that they last in time. As we've heard from all brilliantly, the information we offer on vaccine safety includes or could include, or I should say, influence the health decisions made by people. And when we relate this to vaccine preventable diseases, I think this is very important. So it's important to give the population information that is true, evidence-based, reliable, so that they can make an informed decision based on evidence. But I'm going to refer to two main ideas about these tools or guidelines. One as such refers specifically to the web and the technical content of this. Another, the institutional procedures that will support the sustainability in time. I'll begin with the web and its content. Initially, I want to thank the PAHO team, in particular, the consultants and all of them, for their availability, the support, which has been absolutely fundamental throughout all these months. Initially, we did the diagnosis thanks to the tools that PAHO gave us. And we were able to do one jointly with the agency hired thanks to the funds offered to us by PAHO and several technical meetings that we held with them throughout these months. The initial diagnosis could be said to have helped us do the diagnosis and establish a clear guidance with the uses and recommendations for the web content referring to vaccine safety, which is not only going to do, as I said before, that we do something now, but that whoever's behind that web page can, in the future, have this guideline so that he or she can continue with the credibility, accessibility, or design criteria. The guideline is institutional, and this is very important. It includes all areas of our institution involved regarding the content published in the web. Together with the use and recommendations, we also had several adjustments linked to the navigability and accessibility, or SEO, or search engine optimization aspects. Also take into consideration the main objective, which is the sustainability of changes. We designed a content generation strategy which was similar to the one before. It's a manual explaining step by step, all with all the tools and all the necessary knowledge, so as to identify our public and know them, how to talk to them, what's our target public, maybe using different multimedia resources like videos, charts, or simply get to know the concerns of the people, whether they're more interested in fixed things, let's say, or maybe they have temporary concerns that the population may have because of events that may have arisen in the country. This manual gives us the tools to get to know our target public and how we should talk to them and what we should communicate. In the manual, it's also important the content audit that we call, which clearly explains all the content of the web page, who's responsible for the update, and the update time frame, which is also very important because this way we can trace the quality of the content of the web page in time. The manual also includes results monitoring tools, which is also important because in that way we can have the initial starting point, monitoring the access, the different people, where they go, how much time they spend, and with the tool we can monitor the results afterwards and see the progress, what can be improved, and have some knowledge of what's happening on the web page. The purpose is that with the manual we can ensure sustainability in time and the content update. As an institutional procedure, which I also think is very important, we have the establishment of an editorial council adapted to the available resources the institution had. In that way, we were able to standardize processes that may have initially been done without a clear structure. We were able to identify, standardize, and order them and communicate them institutionally through formal resolutions, ensuring in this way the technical team behind this guaranteeing the commitment to the content. The information is also published on the webpage, and it contributes to the reliability. The technical team, as part of the editorial policy, the team also speaks of the updating of the professionals regarding scientific progress or with knowledge related to the vaccine safety. I don't want to take too much more time with my presentation. All of the changes done these months support and consolidate the institutional responsibility we have. The fight against TB, the content we offer our users, our population, making sure that it's accurate, evidence-based, sound, scientific, and aligned with the guidelines and recommendations of national and international authorities. Without a doubt, it's a project and the work of all these months, together with the PAJO team, has helped us and has contributed tremendously so that we can be closer to this desired membership and be part of the BSN and maybe become a national reference regarding quality information of vaccines. And just as a point of information, I'd like to talk about the quality and visibility of the information on vaccine safety. Some charts that we implemented can be seen on the right, with which we made the navigation more intuitive, more user-friendly, more easy, with illustrations, buttons that invite to action, the references, the links to other sites that could be of interest to expand the information. Here you can see the current visibility of the vaccine card, identification card. It's much more intuitive, it's much easier to navigate. You can find the month of the search and you can see what are the vaccines recommended. It's much easier, much user-friendly. As Claudia said initially, it talks about the vaccine safety in three large blocks of information, which is the savvy surveillance, the cold chain, and the quality vaccines. All of these are linked to vaccine safety. Here, which is the last slide, where I wanted to show you the section on ESAVI and how it can be seen in a user-friendly way with charts, titles, menus, videos, and many different elements that we worked with in order to make this summary of the information much more user-friendly, precisely so that the people, the users on the other side, can receive evidence-based and true information so that they can make informed health decisions. Thank you very much. Thank you, Amalia, for that excellent presentation. And once again, thanks to all the panelists who've been with us all these months and now with the presentation of their experiences. To begin now our Q&A section, I'd like to invite the participants to put your questions on the Q&A chat to get any information you may require from the four panels or from us. But maybe I'll start with my first question for Claudia on something which I'm sure is of interest to all participants of the webinar, which is the credibility. How were you able to show, increase, or prove the level of the credibility published in all the websites of the VSN membership to ensure to the public that what they're reading is reliable? Thank you, Margarita, for your question. The credibility component actually emphasizes the transparency and professionalism when presenting scientific, medical, and health information on the website. These criteria ensure that the public believe the information found on the web pages, and they include things like really showing the source of information, the names, the affiliations, the possible conflicts of interest of the authors, the last date of the review or update of the content to ensure relevance and credibility, and good practices on immunization with a transparent explanation of the risks and benefits of vaccines. These criteria collectively contribute to ensure the credibility and reliance on the information. And furthermore, the organizations throughout this project developed editorial policies to ensure that the decision on the content to publish is based on the needs of the public. And finally, in the evaluation process when applying for membership, WHO assesses all these aspects to make sure that they are clearly published on the website before accepting them as VSN members. Thank you. Thank you, Claudia. So maybe another element we've not talked much about, but which is definitely important, which is the question of the design. How can you make the navigability of the content easier once you have the information updated? Maybe our colleagues from Guatemala might be able to say something about that. How did you deal with this question of the design and the review of the design in the web page so as to make the navigability easier? Thank you, Margarita, with pleasure. As I said, we have a communication team on the web page design, which is part of the ALMA team, who made an evaluation and referred precisely to the VSN membership requirement to compare and contrast and see what we had to improve. But one thing that I can point out from the ALMA team is that we did have a specialist, a designer in usability, a UX designer who has the necessary experience to actually be able to evaluate the page and assess what were the image aspects that were requiring improvement, the colors, the highlights, the bold, where the button should be above or below. Those are the different things which are based on the experience that the designer has of the UI UX. And I'm sure that in that case, it clearly shows the difference. So My only recommendation in that case would be is to have an expert in communications, and even better if it's an expert designer.
Great. Thank you very much, Alejandra. I don't know if we have other organizations would like to also talk about some of the navigability elements that are most essential. And so if not, we're going to look at another question that was posted. I think this is mainly for the Uruguayan colleagues. In terms of the visibility, whether you use Google or other website, did you use any strategy aimed at improving the visibility of the content on the internet? Well, in that regard, we've actually seen two major pillars of support that were essential in improving these search engines. First of all, our analysis of the PAHO tools, the recommendations that already include many minor details that need to be addressed. Looking at, for example, alternative imaging, that it has a certain number of headings and titles. In addition to that, working with Edgar with an excellent level of support, we were able to contract for an initial analysis that was later left to subsequent development efforts, looking at changes that were needed in terms of Google searches or any other internet search engines in order to improve the responses when users consult these contents, reference them, so that it's easy to get on and pose questions. I think these were the two major approaches that were adopted. First of all, our initial diagnosis with recommendations provided by PAHO, and then we hired out this firm of developers who were able to look at our website, and they used several tools for diagnosis that identified errors and where they needed to log on and where not to. Thank you. Excellent comments. Well, we have another question here.
This question to Dr. Shamel in Trinidad and Tobago. Unlike the other organizations, you were working in English, and so you had access to a wider variety of sources of information, both from the VSN membership and just in terms of scientific publications. So could you help us understand how you were able to select the information that you wanted to publish on your webpage? What kind of editorial procedures you went through in order to select the content that best could be used in Trinidad and Tobago?
So the selection of our content really focused on what the information that we would have seen arising from the COVID-19 pandemic. We recognize that there was a lot of hesitation about vaccines and whether vaccines were safe, whether they were actually even preventing any diseases from happening. So hence using that kind of guide us on what information we felt necessary to share with the public. We also relied on our technical expertise from PAHO and from our immunization unit, expanded program on immunization. We use their advice as well, and because they are on the ground and they are working with our regional health authorities. We have 5 in Trinidad and Tobago, so they are the ones who are on the ground. They are getting the feedback from the population. They are getting the concerns. People are concerned about whether or not there's rumors and a lot of misinformation about vaccines giving you heart attack or stroke or causing blood clotting. And so we use that information to really decide what information we felt was necessary based on the concerns raised to share with the public.
Fantastic. Any challenges in these procedures, or elements where additional guidance was needed or support?
Definitely, there were some challenges in getting the information, particularly as it relates to finding articles that we found might have been relevant. And that is where we would have relied on our other VSN members to see what sort of information they were sharing and to ensure that our information was in alignment and that the information was simple enough to provide simple information to the general public that makes it understandable, that is easy to understand, as well as to help them build the trust for vaccines. And we also would have shared, other diseases that Trinidad and Tobago would have experienced several decades ago and show how vaccines would have eliminated those diseases from the country.
Fantastic. Thank you so much, Dr. Shamel. And then maybe a last question for our perdón. Quizás una última pregunta para nuestra compañera de Colombia,
And
Sandra.
then we have another final question for our colleague from Colombia. You are launching your web page on vaccine safety in the context of the health ministries' official website. How do you interact with your public in terms of vaccine safety? Are there other elements that you're going to be using once your web page is officially launched and published? Yes, one of the issues that we're looking at is in our articulating with the users of our webpage, we're going to have an email resource where we can get questions from the public. I think that's going to help us in expanding and upscaling our website usefulness with the public. We're also looking at constantly looking at the methodologies in the consultations regarding specific content. Excellent. Thank you very much, Sandra. I'd like to thank all of the panelists for highlighting these components that are so essential when we talk about vaccine safety: the navigability, the credibility of the content, the visibility, and how on the internet we can ensure that our web pages are the key references when we talk about vaccine safety, and how we continue to update the content to ensure that the information is always up to date and that reflects and addresses the needs of our public, and how we continue to engage with the public to ensure that we are effectively responding to the public's questions and needs, and we remain up to date. Well, thank you very much. We're almost at the end of our webinar, so I'm going to offer the floor for some final comments by Felipe Molina. Thank you very much, Margarita, and I'd like to thank all of the participants from all of the organizations and public health agencies interested in supporting the content and visibility of their web pages relating to vaccines, so that all of us will be able to remain better informed and up to date. I think this level of participation confirms the interest of the region in supporting the dissemination of information different from, and that varies from one vaccine to another. Communication regarding the safety risk of vaccines is essential so that the public understand that despite occasional adverse events, the benefits of vaccines are very high and they overcome any risks. And we also are able to detect early on the risks and that could compromise the health of the public, and we can take measures immediately. We know that sometimes it is difficult to decide about without the abundance of information on vaccine safety. That's why we are advocating a dissemination of information that is up to date, accurate, timely, and complete. And we also thank all of our panelists and the participants in this project as we have expanded the vaccine safety net in the region of the Americas. We want to thank you for your participation and enormous efforts that you have undertaken to ensure that their websites maintain that visibility. We also would like to thank the WHO and the teams that have coordinated efforts in administering and maintaining the VSN websites, also the US CDC for their contributions to the discussions within the context of this project. And we also like to thank them for their contributions in addressing many of the challenges. The webinar today has been crucial in being able to present the VSN evaluation criteria and ensure that we are updating the content on the web pages, addressing the vaccine safety, risks, and to ensure that through the WHO, as you know, that the criteria and mechanisms for encouraging participation are working with the WHO as well as PAHO, where we communicate the information, we provide the necessary links in order to apply to the vaccine safety network. Those of you who are joining us today, I know we'll probably need to make changes to some of your websites to ensure that you meet the requirements. We hope that this large scale information dissemination through the network, as well as the specific support to our four selected organizations, will enable the public in our region to derive greater benefits relating to vaccine safety in their own language. And we want to thank all of our participants for being here. Well, thank you very much, Felipe, for those departing words. And we'd like to thank all of our participants for joining us. We'd like to thank the team that were involved in this process and initiative, and we're hoping over the next few days we'll be able to put this discussion on our website. We have, of course, all of the materials that we discussed during the webinar included, as well as links if you would like to join the VSN network as a member. So again, we'd like to thank you very much and wish you a wonderful afternoon.